Hello, future doctors. How are you all? Welcome back to MedSteps ECG Series, Day 13 by Dr. Anand. So far, we have learned normal cardiac axis, left axis deviation, and right axis deviation. So today, we are going to learn the most abnormal cardiac axis, that is, we called extreme axis deviation, also known as the northwest axis. So this is an important ECG finding because it often indicates serious cardiac disease or life-threatening arrhythmias. So let's understand it step by step. So without time waste, let's begin. So what is extreme axis deviation? So normally the electrical impulse travels downward toward the left ventricle. Sometimes the impulse travels in an abnormal direction toward the upper right side of the heart. So this is called northwest axis deviation, also known as extreme axis deviation. So in extreme axis deviation, you can see the QRS complex will be like minus um, 90 degrees to plus or negative 180 degrees. So remember the axis normal ranges so far we learn. One is normal axis. So in normal axis, we can say minus 30 degrees to plus 90 degrees. Next, we can see left axis deviation like minus 30 degrees to minus 90 degrees. So next we can see that is right axis deviation plus 90 degrees to plus 180 degrees. So in extreme axis deviation, we can see like minus 90 degrees to plus or minus 180 degrees. Okay, so this is the thing. So in normal axis, we can see negative and positive. In left axis deviation, we can see minus and negative values. In right axis deviation, we can see both are positive. And in extreme axis deviation, we can see minus 90 degrees to with or without 180 degrees. So how to identify? So we have to look at lead 1 and lead AVF. If lead 1 is negative and lead AVF is also negative, then the diagnosis will be like extreme axis deviation. So here you can see it's going down and AVF also going down. So that is left axis deviation. So we have one memory table. You can see here lead 1 means both are positive. Lead 1 and lead AVF will be positive, then we call that is normal axis deviation. Okay, so lead 1 is positive and lead AVF is negative, then we have to tell that is left axis deviation. If lead 1 is negative and lead AVF is positive, then we call that is right axis deviation. If lead 1 and lead AVF will be like negative, then we call that is extreme axis deviation. Okay, so in negative means that is northwest axis, means extreme axis deviation. What is it called? Why why is it called the northwest axis deviation? If you're seeing here, imagine a compass. You can see here, imagine a compass instead of pointing downwards towards the ventricles, the electrical impulse pointing upward and to the upward to the right. So this direction corresponds to the northwest quadrant, which is why it's called the northwest axis. Okay, why this extreme axis is dangerous? If you're seeing here, so extreme axis deviation is not normal most cases. Okay, so it often indicates like severe conditions, serious conditions of cardiac diseases or life-threatening arrhythmias, advanced heart diseases, and extensive myocardial damages. Okay, severe conditions, abnormalities, ventricle rhythms, advanced heart diseases, extensive myocardial damage. Whenever you see an extreme axis, evaluate the patient immediately and interpret it together with the rest of the ECG. So always we have to correlate with clinical conditions, then at last we have to do management. Okay, so 5 common causes of extreme axis deviation now we are going to discuss in very important and detailed. So first one, we can see ventricular tachycardia. In ventricular tachycardia, the most important cause will be like the electrical impulse starts in the ventricles instead of SA node, because The conduction is abnormal. The axis may become extremely abnormal. So in ECG features, we can see wide QRS complex, fast heart rate, and extreme axis deviation. Next, you can see that is ventricular escape rhythm. So ventricular escape rhythm occurs when the SA node and AV node is failed. So the ventricles become the pacemaker. This often produces like wide QRS, slow ventricular rate, and extreme axis deviation. Next, you can see that is severe right ventricular hypertrophy. So severe right ventricular hypertrophy will be like massive enlarged of right ventricle. Okay, and it can occasionally produce an extreme axis, okay, deviation. So next we can see in some electrolyte abnormalities, that is severe cases like hyperkalemia. So in hyperkalemia we can see very high potassium levels may cause like wide QRS complex and abnormal conduction and extreme axis deviation. This is a medical emergency. So next we can see that is congenital heart disease. In some complex, we can see congenital heart diseases can produce an extreme axis. Examples include like complex congenital heart disease and severe ventricular abnormalities. So next we can see that is some ECG findings. In ECG findings will be like typical ECG findings include lead 1 is negative. So you can see it will go negative downward, and AVF is negative. AVF will also go downwards. Okay, it often associated with wide QRS complex and abnormal ventricular rhythm and abnormal morphology. In clinical example, you can see here one patient came to the emergency department, like 68 years old patient presents with collapse and severe palpitations. The ECG shows heart rate 180 beats per minute, wide QRS complex, and lead 1 is negative and AVF is negative. Then it's extreme axis. So we can call that is ventricular tachycardia with extreme axis deviation. Okay, in clinical importance, the extreme axis deviation should always raise concern for ventricular tachycardia and life-threatening conditions, severe conduction disease, advanced structural heart diseases, and severe electrolyte disturbance. So it should never be interpreted in isolation. Always we have to correlate with symptoms, heart rate, and QRS duration and clinical condition. Okay. So these are the things. Next we have that is another one, systemic ECG approach. Like we have to look at lead 1 and lead AVF. We have to interpret it if both are positive normal axis deviation. If lead 1 will be like positive and AVF is negative, then we call that as left axis deviation. If lead 1 is negative and lead AVF will be like positive, we have to go think about right axis deviation. If both are negative, we have to suspect extreme axis deviation. Okay, so this is the angles we already discussed, that is normal axis and left axis deviation and right axis deviation and everything. So we are concluding that right axis deviation, extreme axis deviation. So let's discuss little amount of causes of every axis. So in normal axis, we can see here in normal axis, the lead 1 will be like positive and lead AVF will be like negative. So the QRS axis we can say minus 30 degrees to plus 90 degrees, and the main cause will be like healthy heart. Okay, next we can see left axis deviation. The lead 1 will be like positive and lead AVF will be negative. The QRS axis will be like minus 30 degrees to minus 90 degrees. So the most common causes will be like left ventricular hypertrophy and left anterior fascicular block and inferior myocardial infarction. Next we can see that is right axis deviation. The lead 1 will be like negative and lead AVF will be like positive. The QRS axis will be like positive 90 degrees to positive 180 degrees. So the common cause will be like right ventricular hypertrophy, pulmonary hypertension, and chronic obstructive pulmonary disorder, pulmonary embolism, and left posterior fascicular block, and we can see congenital heart diseases. So these are the most like common causes of right axis deviation. In extreme axis deviation, the lead 1 and lead AVF will be like negative, and the QRS axis will be like minus 90 degrees to plus 90 degrees will be rare. So the most common cause and life-threatening of extreme axis deviation, that is ventricular rhythms and severe ventricular diseases. Okay, so extreme axis means wide QRS and thick. Whenever patient getting wide QRS and extreme axis, think ventricular rhythm until proven otherwise. We have to rule out other pathological conditions. So congratulations, you know now all four cardiac axis patterns like normal axis rhythm, deviation, left axis deviation, right axis deviation, and extreme axis deviation. So in day 14, we will begin systematic ECG interpretation, learning the exact 10 steps approach used by cardiologists to read every ECG confidently. So see you in our upcoming ECG day 14 videos, ECG lesson on MedSteps by Dr. Anand. Till the time, take care.